Hi, Dr. Milky back with another, I'll call it a hot topic because I've had probably at least 5 to 7 patients who've come to me in the last 2 to 3 weeks who have either gone to urgent care or to the emergency room because of something they were concerned about. And in some way kind of got misdiagnosed. And not to bash the urgent cares or the emergency rooms, they're doing a great job. They don't know foot, ankle, lower leg because that's not what they specialize in. So they're probably just doing their best to, make sure that there's not something serious going on, like a blood clot or major infection or that type of thing. But sometimes they give advice and they make it seem like if it's not a blood clot or it's not an infection, then you're just going to be okay. When in fact, that's not always the case. So I had someone who had leg pain, didn't have a blood clot, but they said everything's okay, you're fine, and he wasn't fine. He ended up having a blocked artery. I was able to assess that based on the lack of circulation and send him to a specialist. And there's other cases where there's swelling and they thought it was an infection, but it actually wasn't an infection. So if you're having some sort of pain, swelling, something, um, in most circumstances, try to wait until you can get into the office because it's going to be less expensive and you're probably going to get a more accurate diagnosis and just get to the end result quicker. If it's something you're really concerned about, it's a weekend, whatever, then certainly not a bad idea to go urgent care. But I would say after that, follow up in the office because, again, things get missed. And I've seen, fractures get missed. I've seen a number of things get missed in ingrown toenails, things like that, that they really don't have a lot of experience with. So just know that they're doing their best, but they're not always going to come up with the most accurate diagnosis, and sometimes they will kind of just put off, something that needs attention by a specialist. When in fact, they might think that it's just nothing because it doesn't look broken or it doesn't look, seriously infected and it's not a blood clot. So I think that's an important message that everybody needs to know. Again, feel free to pass these on, and we will see you next time.